The views and opinions expressed in this video are solely those of Jacob Martin. In no way does any of the video represent any school or university. Although much of the research and analysis was performed with actual data and models, examples are to be interpreted as just that, examples. There is so much data coming in on a daily basis that the data has already grown in depth and evolved into more concrete data than what was used for this creative exercise. There is also risk that the repackaging of information could be misinterpreted. This creative exercise is designed to express design connections, opportunities for advancement, promotion of dialogue for the sake of new ideas and concepts, by way of one designer's vantage point. We're going to touch on quite a few variables, and we'll simplify and define some parameters to focus in on some more contained scenarios. Just remember when information is presented in a matter-of-fact delivery to still question and ask what if, why not. From a format perspective, I was adamant to deliver the content in a video format. I strongly believe that video production and product design offer each other a multitude of cross-disciplinary tools. Although I'm just scratching the surface, I hope to inspire and invite other designers to use video production for visual communication methods. We're going to set a baseline and understanding of some data, vocabulary, and understanding of the world around us. 2, we're going to look at a concept for contact tracing software and product design, which is our focus for our creative component today. We're going to look at execution, evolution, and alternate applications for the software. As I speak to you right now, droplets from my mouth are landing in that cup. I can't see them, but I know they're there. I know because I proved it in a microbiology lab in 2009. When I began working in a quality assurance laboratory, my colleagues warned me that if I talked around open samples on the table, that I would contaminate the samples. I did not believe them until samples failed testing due to contamination time and time again. So when I hear of an airborne virus passing aggressively from person to person, I think of these invisible droplets that I know are there. I think about them every time I'm near someone or something around me within 3-foot distance. Then I think about the variables that can affect these circumstances to either promote or deter the result. Temperature, humidity, environment, airflow, distance, duration, transmittability, lethality, exposure, mutations, variance. Now enter design. We need a baseline understanding of the variables. We need to acknowledge the variables and determine which ones to simplify and which ones to attack. Great design approaches a problem in an effort to progress towards a solution. A complete solution is rarely achievable. So what are we talking about today? We're talking about a contact tracing product. We're talking about acknowledging variables and systems and determining which ones we're simplifying. We're talking about the first step towards a solution so that the next step or next person can take it further, so that we may inspire more development. Let's define the main variables and some sub-variables in those categories. Let's start at the core, or better stated, the finish line for our little journey. Contact tracing software and products. That is the most underutilized and that can make the biggest impact in terms of preparedness for the next unsuspecting virus is contact tracing. Part of the reason it's at the nucleus of our exercise is that we're not really designing for SARS-CoV-2. We're learning from it, but we're designing for the next virus or next radical mutation. We're using our learnings and familiarity with SARS-CoV-2 and the experiences of the last year to lay the foundation of design for future circumstances and future products. And we see that this is important because we see the response to SARS-CoV-2 to countries and regions that have a comparable baseline of somewhat similar virus behaviors to adapt to combat to SARS-CoV-2. For example, China SARS-CoV-1 experiences, Africa Ebola experiences. They had a baseline reference that they learned from that they could reference to more quickly communicate and combat and understand the circumstances. The US, we have SARS-CoV-2 as our baseline, and we are designing for the future. Let's establish our baseline. Distance, 6 feet. Filtration, cloth mask, duration, 15 minutes. These are the guidelines communicated to the general public in the US. This is the understood baseline for combating transmission of SARS-CoV-2. We're going to look at the upper and lower limits of the three categories and the combination of these variables in comparison to our understood baseline combo. Once we've understood protection combinations, we'll look at how mutations and potential future strands look like when redefined in our understanding of terms of protection. Good design speaks to people in a way of leveraging familiar elements. The way faucet handles work, a steering wheel, a doorknob, a toothbrush handle. These are all familiar recognition cues and established interactions. For our scenario, our familiarity to protection methods is the combination of three general rules. Social distance of 6 feet. Understood. Cloth mask. A level of filtration preventing droplets that exit the mouth and a level of filtration that prevent droplets from entering the mouth. Duration is a little bit trickier because it lacks depth of background. It lacks context. 15 minutes? Why 15 minutes? Why not? The best example of misunderstanding duration is a story I heard of a rural school's designing for this parameter. They decided they would set a timer for every 15 minutes. Every 15 minutes the students would get up, switch seats, and they'd start the timer again. Therefore not breaking our baseline rules. Later they realized that this was not a good idea because it would expose everyone to everyone the fastest way possible. But it gives you an idea of what can happen when design tries to solve misunderstood problems. You must step back and look at the larger picture, even if you are designing for one parameter. You need to know enough about what you don't know to surround your problem with enough depth of understanding to lead a good attack. Design attacks problems and needs. Let's pause and define exposure in terms of our understood guidelines. If protection is defined by following our guidelines, 6 feet, cloth mask, 15 minutes duration, then we will define exposure as the violation of those parameters. We're going to continually try to tie back to our understanding of exposure and stretch these variables to keep future scenarios as familiar as possible to the end user. Distance, 6 feet. Enough distance to keep droplets away from each other. Let's stretch this variable to an upper and lower limit. 2 feet, close proximity that we are used to, close enough for droplets. Exposure. 16 feet, a fair distance apart even in stagnant environmental conditions. Filtration, the cloth mask providing good protection from sharing droplets with respect to our other two variables. No mask, no level of filtration, and within the confines of our other variables, exposure. And an upper limit of N95 mask, offering superior filtration even in close proximity. Duration. 15 minutes, a casual interaction, keeping in mind our other two variables. 2 seconds, a walk by, not much time to share airspace. More than 15 minutes, time enough for shared airspace, much more than a casual interaction. Exposure. These are terms and variables that we are familiar with, but they are simply translations of more technical information represented in familiar terms. Let's take a look at viruses and diseases in comparison of transmittability and lethality. Transmittability is what we're focusing on in our exercise, and we'll touch on lethality. Transmittability is the ease of transferring disease and virus from one person to the next, and so what we're calling exposure is a possible scenario to which the virus SARS-CoV-2 could be transferred. While we're on this graph, let's make note that the aggressive and dangerous mutations are moving the virus in this direction. For the purpose of our exercise, we're focused on transmittability in our terms, exposure. We'll touch on lethality, how it fits our model, but we're focused more on exposure because it ties us to our end product. Back to our variables. Let's combine variables and see which combinations still combat our original strain of SARS-CoV-2. Once we develop some depth to our variables and combination of variables, we'll look at adjusting to more aggressive mutations and variants of the virus. We're going to give our baseline combination a name, protection level. Our baseline combination of cloth mask, 6 feet, and duration of less than 15 minutes. We'll call that protection level 1. No mask, close proximity, longer than 15 minutes, we'll call this protection level 0. Now we have a scale. We'll try to reference numbers again from this point that the virus is based on transmittability and aggression of mutant variants or potential future viruses that exhibit similar behavior. Combination of our 3 protection variables with one of the 3 weakened, such as maintaining cloth mask, maintaining the duration of less than 15 minutes, but now we take 6 foot distance down to 3 feet, that would put our protection level at less than 1. Let's say 0.5. Going from 6 feet to 3 feet is exactly what the CDC rolled out as their solution to get more kids back in the classroom. Obviously, there was a bunch of follow-up criteria, caveats, and asterisks. What that statement proved to me is that the CDC used our baseline knowledge of 6 feet to communicate 3 feet of space. Another example of using this baseline and deviating to speak to the general public was when the doc said the UK variant was rampant, wear 2 masks. The only difference in that statement and what I'm describing is rather than 2 masks, I'm saying an N95 mask. So using our baseline parameters is a good communication tool to develop depth and build for the future. Let's say we have a more aggressive mutation such as the UK variant. It requires a protection level of 1.5. A protection level of 1.5 is achieved by boosting one of our variables in our combo. For example, cloth mask, less than 15 minutes duration, but now 16 feet instead of 6 feet. Or cloth mask, 6 feet, and a very brief interaction. Or N95 mask, 6 feet, and less than 15 minutes. What would happen to achieve a protection level of 2? So we've established our baseline, we've developed a scale, we've started to mirror protection level to correspond to original SARS-CoV-2 strains that entered the US and adjusted it to combat the UK variant. We'll call the transmittability of the virus exposure level. Exposure level 1 is the original strain that entered the US. Exposure level 1.5 is the UK variant, which can be transmitted more easily. An exposure level of 1 is combated by a protection level of 1. Exposure level of 1.5 combated by a protection level of 1.5. We didn't invent anything new, we're just trying to repackage information in terms that we can relate to. These terms are simplified, so let's add some depth. Let's look at exposure level from the viewpoint of the virus and try to graph it to see that the relationships between our baseline variables is not linear. Here's an attempt to create a gradient of the combinations of our protection efforts. It is in essence a graph of transmittability based on positive and contagious subject with no mask interacting with a person using the 3 guidelines of protection. The main graph shows the person not using a mask with the different combinations of distance and duration. The smaller graphs show the same variables but with the person using a cloth mask and an N95 mask. The numbers at the bottom show potential exposure. Given the parameters, what percentage are you likely to be exposed to that person? As transmittability goes up, as is the case with the UK variant, we see more aggressive potential exposure for the same parameters, especially at close contact. We'll also look at a hypothetical mutation that would require a protection level of 2. The graph focuses on transmittability and exposure. Not recognized are lethality, which would blanket the entire graph, or demographics, which would blanket it as well. Often in design, certain variables are simplified or unfortunately ignored. It's important to know enough about the surrounding variables to recognize that you are simplifying them or compromising on efforts in that area. It is also as important not to spend too much time on distant variables. But you have to go off the edge of the table to know where the edge is. We understand 6 feet, mask, duration. When content like that is delivered, give us more depth. Let's keep building our collective understanding. The president says more resources for schools to reopen safely. He's right. That's the correct answer. Now remember, we're designing for future mutations or future viruses, and if those are more aggressive towards children, let's be ready for it. Let's be proactive for our children in schools so that we can be ready. Resources for schools. Resources for schools. Funding for schools. Money and efforts for schools. Where do we start? Contact tracing. The product concept we're talking about today is individual tracking sensors and accompanied software. As the student arrives at school, they are given their ID badge. This is kept at school. This is unique to them. They wear it around their neck, positioned about chest high. This is the child's real-time tracker for monitoring position all day long in 3 dimensions, meaning it records real-time where the child is positioned in the school, including what floor they are on. It records proximity and duration to others. It is retained at school and it is rechargeable. We have the luxury of leveraging either Bluetooth or GPS technology to adapt to our application. So we'll mostly be focusing on what instead of the how. Now keep in mind we're designing for the future. Evolving viruses with different aggression levels. We're simplifying variables such as lethality. We're designing for transmission of viruses. This product will deliver the following major benefits to the user. 1. An individual record of exposure to others. This will be used to contact trace users for day, time, distance, duration of exposure from one person to the next. 2. Locations of congestion. By tracking real-time location, we can review when and where multiple exposures happen. 3. Automated quarantine response. With exposure tracing going on in the background, a positive case can be entered into the system and resulting exposed individuals can be communicated to for directions for quarantining. 4. Custom virus characterizations. Mutations and future viruses can be customized based on their parameters of aggressiveness. This helps proactive measures of safety as well as reactive should a positive case be more or less an aggressive strand. For the time being, we're going to say that the school administrator manually inputs mask level. For example, grades K through 5 will not be wearing masks today. Now your combination of distance and duration will ultimately create the threshold of exposure within the parameters set by your automated software. This takes the burden off the teachers and administrators and allows the capturing of data to go on in the background. This allows focus and attention to essential duties and less pressure on the teachers and administrators. Locations of congestion. This is a self-describing term, but basically the software is shifting data review from the individual to the situation. The software can look at multiple exposures happening at once in close proximity. It can identify clusters. This can be very beneficial for proactive planning and reviewing execution of plans. For example, the plan is in play to keep students distanced by 6 feet for the duration of the day, but the software is noticing an abundance of exposures happening around 11:30. The software shows when and where these are taking place. They are taking place just outside the cafeteria before lunch every day. The staff had planned for classroom spacing and executed well, but now see room for improvement. So at 11:30, they stagger the release of classrooms before lunch and see that there is no longer an uptick in exposures at 11:30. This is a great tool for learning from yourself. Similarly, it can be used to measure metrics throughout the year or even set guidelines for your exposure in your region or your state. Let's say there's an increase of the UK strand in a community. Schools in this area must adhere to a 6% exposure rate. During the week, the exposure can be reviewed as to which schools in that area are executing and which need to improve their amount of peer-to-peer exposure. Automated quarantine response system. Based on predetermined quarantine instructions, once a positive case is entered into the system, a filter reports out who was exposed to that person based on the virus parameters of transmission. This can look like a hard and fast separation. These 6 students need to quarantine at home for 2 weeks. Then everyone can return. Or it can be a gradient of high, medium, and low risk, where the high risk 6 students are to quarantine at home. The medium and low risk families will simply be communicated to, allowing them the option to quarantine or limit exposure at home. Custom virus characterizations. We touched on the fundamental variables of mapping the virus in terms of what we understand as our baseline or defense. It can be a segue to adding depth if protection methods change, if unique transmission parameters change. Contagious periods can be associated with specific viruses or strands of the virus. Even more depth can be added for transmission periods. Vaccination types and associated protection efficacy, protection longevity, booster schedule. Now all of a sudden, without much effort, each student has their own protection profile. Introducing outside data to keep the system up to date can be a software initiation or the combination of CDC guidelines and state-level vaccination records. The state is a vaccination database to keep track of kids' vaccinations. The CDC can send out regional updates based on strands behavior, strands in the region, and so on. It's a nationwide community of information and resources aimed at providing schools with automated tools going on in the background. Resources for schools to open safely. We're not only talking about a product and service for contact tracing, we're talking about a sustainable systemic movement that proactively addresses future scenarios by leveraging what we learned and what we're familiar with. One of our focuses for relieving the burden on teachers and administrators would be to employ specialists in this field that would lead the administration and implementation of the software and products. This can look like an employee who can be trained that sits within each school. It can be an individual that works with multiple schools. We see parallels in industry that operate similarly, such as health and safety coordinators and even outside governing bodies like OSHA. This can operate similarly, and should, because we see things like this that operate when there's funding for it. I think you'll agree once we look at applying this product and service to other industries, it's an obvious partnership when there's funds available. Following our OSHA reference, let's look at a manufacturing facility. Contact tracing services showing that exposure rates are less than 2%. It's safe to come work for our company every day. How safe? This safe. We can prove it. Our office space is safe. We have less than 1%. We now have herd immunity in our office, but if an aggressive mutated strand comes to our region, we've proven that we can alter our work style to have exposure less than 1%. Contact tracing can also have huge benefits in terms of efficiency within a facility. Reducing foot traffic and congestion. Spaghetti diagrams created by the software can show how workplaces such as manufacturing facilities can be optimized just by looking at the motion and movement of people on a daily basis. This can be used to hold government, businesses, and people accountable when they force people to work in hazardous conditions. When worker bees are forced into unsafe conditions and can't afford to lose their jobs. When meat processing workers are forced to go back to work, prove that it's safe. Use contact tracing software and products to help you get a safe work environment. A governing body similar to OSHA can set standards for safe environments, can audit organizations to maintain certification, can train organizations to learn how to develop a culture of safe practices for times when it becomes necessary again to protect ourselves. This methodology of contact tracing can be expanded beyond just person to person as well. For example, within hospitals, different people or different regions can be categorized as more hazardous exposure areas. Somewhere someone is working at a radioactive site. The radioactive exposure meters can be tied to and recorded with the contact tracing software. Now we're adjusting the contact-to-contact variables to open up even more doors for alternate uses. The pandemic has pushed many of us into new territory, asking us to do more or do things differently than what we're used to reduce the spread of the virus. Two key interjections have driven a multitude of product designs and logistical systems design: masks and social distancing. All kinds of masks have flooded the market: homemade masks, existing surgical masks, cloth masks, masks with an open exhale valve. There was and is no shortage of product designers rushing to the market. In terms of social distancing, we are asking a new group of people to design logistical systems to accommodate spacing: signage, stickers on floors, arrows, capacity limitations. Today we focused a lot on how the product, service, and philosophy it follows. But the goal was a system that can be introduced into an elementary school. An atmosphere often underfunded but prevails because of the hearts and passions of individuals. The ultimate goal in this exercise was to advance the thinking and mindset of those out there being asked to be designers. Maybe there's an idea in here that sparks advancement or triggers a thought on how this can be improved. Maybe these ideas can be translated into advancing children's hospitals or child safety, logistics, social distancing. Maybe it will simply remind you to keep a positive outlook when introducing restrictions, and that ways to make people smile is just as important as the end result. We talk a lot about constraints: masks, barriers, spacing, signage on the wall, stickers on the floor. A lot of these principles and images can create fear and anxiety. It's important to strive to change these constraints into more inviting images and symbols. We can do this in a number of ways. We can make the mask so we see the mouth and facial expression. Instead of barriers, we can create incentive or invite users to follow a path. We turn barriers into something fun.